Telemedicine was already gaining in popularity before COVID-19, and in light of this pandemic, it has become the new norm for many doctors and patients. Joining me today to discuss the benefits of telemedicine is Dr. Peter Oppenheim, Medical Director of Population Health Services for Salinas Valley Memorial Healthcare System and a family medicine doctor at Primecare Salinas. This is Ask the Experts, a podcast from Salinas Valley Memorial Healthcare System. I'm Scott Webb. So, Dr. Oppenheim, thanks so much for joining me today. Why did Primecare Salinas move to doing telemedicine during this pandemic?
It was actually pushed as a way to make sure we could keep access for patients. Hats off to our administrative team. They actually got us up and running for video conferencing and video visits and telehealth, telemedicine in a week. We started on a Wednesday and we were up and running with our first video patients actually just under a week on the Monday afterwards. So it took them about 4 days to get Zoom on all of our iPads, get accounts, and get us going. So it really was a direct response to the COVID-19 as a way to make sure we could provide access to patients and still keep other patients and providers safe and healthy.
No, that's great to know. And so I'm wondering, because I'm getting from listening to you that telemedicine wasn't the thing yet, right, at Primecare Salinas, and so COVID-19 kind of forced your hands. How's it going so far?
In terms of acceptance, it's going really well. I have some providers in my office that are seeing up to 80% of their patients via telehealth right now. Some of us are seeing less, around 20%, but anywhere between 20 to 80% of the visits right now are telehealth. In terms of acceptance, patients are appreciative that we're providing this service. A lot of them are scared and don't want to come in because of the information they're getting through news and online. So they're very worried. So it's an opportunity for us to provide care to people who would otherwise would have canceled their visits or not been seen. In terms of video versus telephone, I definitely think the video provides an additional level of information to me as a provider that the telephone doesn't. It definitely helps to be able to see people, and I've had a number of visits where people will show me something on their body, which I obviously wouldn't be able to see over the phone, or I'm able to turn my camera around and show them their labs and things that I was concerned about. Just like we were sitting together, what I often like to do with my patients is show them their labs over time, and this is something I can do via video so they can really see where things are going, and that's helpful. You can do a lot by talking to people. I think the physical exam is absolutely important and imperative, but sometimes if you ask the right questions and you're able to look at the person while you're talking to them and getting the feedback, and they're able to show you, where things are, even before you lay hands on them, you have a good idea what you're looking for. And if it's an acute issue, the exam is just to confirm things. If it's a chronic ongoing issue, the exam can help you tell how things have been doing over time in comparison to prior exams. So you can get a lot of the way there. And that's not to say that extra, last 20% isn't vital and it's important, but you can do a lot.
Are you still seeing patients we'll call it the regular way?
Absolutely. I've had some days that 40% of my visits were telehealth. I've had some days where 10 to 20% of my patients have been telehealth. Actually, before this talk, I surveyed some of my partners in my office. We have about 20 providers in our clinic. It's a pretty big clinic. And I've had ranges from, like I said, 20 to 80% of their visits have been telehealth. I've had some providers that just, for whatever reason, most of their patients prefer telehealth visits, and I've had some providers that are down closer to about 20%, which is where I was yesterday, but the day before was 40%.
So we were talking about how maybe this is the new normal, but there will be a new normal, if you will, after COVID-19 passes, right? And so do you expect at Primecare Salinas and other hospitals across the country that maybe weren't doing any telemedicine or only doing it part of the time, do you expect that to become part of the new normal? Is this going to be something that you're going to continue to do after COVID-19 passes?
I think it's something that we'll always have in our options that we can provide to people. I do see a role for it, but not necessarily as extensive a role as it plays now. For example, we have a lot of older patients, and one of the things that we try to provide for our older patients, especially our patients that are in our local Medicare Advantage program, our managed Medicare program, is an annual wellness visit. And That's a visit that by definition doesn't include a physical exam necessarily. It's more a survey of their home safety and health risks and a review of their preventive health measures and immunizations and a check of their mobility, which you certainly can do on a video. You can just have them get up and walk, and you can do that from afar or from distance. And I could definitely see telehealth playing a role for that, especially for our patients who have trouble getting in, where transportation's an issue, where just their own mobility is an issue. And we've had trouble getting those folks in for these visits because I think they're important visits to see where people are health-wise and to keep them healthy or as healthy as they can be. And it's a good way to reach those that we would otherwise not be able to see or provide access to.
Well, it sounds like patients at Primecare Salinas and Salinas Valley Memorial Healthcare System in general are in great hands. And of course, nobody wanted COVID-19, but if one of the small benefits that comes out of that is telemedicine, and that makes things easier and better for doctors and for patients, that's awesome. Dr. Oppenheim, thanks so much for your time today. Any last thoughts about COVID-19, Primecare Salinas, and how you're dealing with it, and what people can do to stay mentally and physically, active and positive during these times?
Yeah, what I've been telling people is I think it's important to be vigilant, to follow the directions in terms of social distancing, to take appropriate care to mitigate your risk, but not to panic. I think when people panic, your higher brain shuts off. And if you take appropriate precautions in a reasoned response, I think you're doing the right thing to protect yourself, your loved ones, your community, and I think that will help reduce the amount of time that we have to quarantine and social distancing. My hope is that people stay calm and think it through rather than panic.
That's great advice, and I feel so lucky that I get to do these podcasts because I get to talk to the experts, like you, and I always feel better when I do because you guys always seem to say the right things, the things that help me to stay calm, to not panic, to understand that this will pass. It will. These are interesting and unusual and unprecedented times, but it'll pass. Dr. Oppenheim, thank you so much for being on today. Really appreciate your expertise, your advice, and hope to talk to you again. Thank you. For more information on COVID-19, visit svmh.com/coronavirus. And to schedule an appointment with a Salinas Valley Medical Clinic Primecare physician, call 831-751-7070. We hope you found this podcast to be helpful and informative. I'm Scott Webb. Stay well, and we'll talk again next time.